Hi everyone, Jessica, clinical psychologist with psychcollective.com.
Alan Briscatus, psychiatrist.
Okay, so I'm here to talk to you today about these schema cards that I've made up. So these I developed as a resource, partly because from a training workshop that I've been running through the Psych Collective on schema therapy, but also evolved as just a really helpful way for me to help my patients understand and conceptualize their own schemas when I'm working with them in private practice. Okay. Schema can be really tricky because it's very much a cognitive therapy. There's obviously behavioural and experiential components to it, but the schemas themselves, they're very cognitive. There's a lot of moving parts. Based off the newest research with the schema questionnaire revised, the YSQR, there's now 20 maladaptive schemas. Okay, that's a lot for people to remember. Now, no one has all 20, and some of them are contradictory, so you can't have all 20.
So are these cards each of the schemas?
Yeah, so these are the 20 maladaptive schemas with the green borders. Okay. What you also have is the way that you've got the needs. So schema therapy is all conceptualized around the idea that a maladaptive schema developed because you didn't get your needs met.
Okay, so need wasn't met, therefore I've got whichever maladaptive
Yep.
schema. Okay.
So what I've done is, because the schemas are set up by domain based on the need, is I've made need cards and I've kept them color coordinated. So you know that the attachment need is in this attachment domain and all of these are then in the same domain. All right.
Okay.
And what I've done is on this side, you've got if the need was not met, what it would look like. So you're reading through that going, oh yeah, so it's like love is conditional or inconsistent like a poker machine. Parents are absent or unreliably present. And if you're listening to this going, yep, that sounds like much. Then
an attachment need wasn't met.
Yes.
And so one of these schemas is going to be in
or
play.
multiple,
Okay.
some or other. So then we lay out, you've got your autonomy needs, realistic limits, freedom to express, I'm going to pop that over there, play and spontaneity.
So can I just, so if you're doing this, would you read the needs cards? Is that where you'd start, at needs cards?
No, you probably actually start with the maladaptive schemas, because usually when we're doing schema therapy with a patient, the first thing we would do is get them to complete the YSQR, which is the schema questionnaire.
So you'll know roughly which of these schemas is going to be relevant, okay? And then you can look at the was this need met, and does that explain?
Yeah, so usually when I'll say to someone, right, you've got a defectiveness schema, and I say, look, people would often develop a defectiveness schema because they didn't feel secure in their attachment at home. So when they were growing up, maybe they didn't feel like they were wanted, they didn't feel like they were worthy, they didn't feel like they were had a place within the home, and that tells me that the attachment needs are not met. So this kind of this is the what, and this is kind of the why.
Okay.
Yeah. Why you developed this is because these needs weren't met.
Got it.
All right. But with the newer research that's come through with John Philip Lewis and his team, he did his PhD on looking at, well, if we've got all of these maladaptive schemas, then wouldn't we also have adaptive schemas? So he's done, based on his research, he identified 14 adaptive schemas. So they don't match up perfectly. They're pretty close. I've got a table for you in the Schema Mode Therapist Guide that will tell you kind of the matchup of all of it. And in the Schema Mode Complete Set of Worksheets at the very back where we've got the pages on the adaptive stuff, that'll tell you the matchup between them as well. But I color-coded these two because that's how my brain works.
So if I've got a social isolation maladaptive schema, then the complement to that is the social belonging.
Yes.
Okay, got it.
So, oh no, you got me out of order now.
Sorry.
So the way these work is basically the way they did the research is they took all of the questions from the maladaptive schema questionnaire, they inverted the language, so they turned it from the negative into the positive, did factor analysis 3 times and came out with 14 domains, okay? So and a lot of it is kind of matching up. If you've got a dependency and competence schema, maladaptive schema, then your adaptive schema is competence.
So you're saying, is that the remedy then to the maladaptive
Pretty
schema?
much, yes. So the way that you would kind of control or mitigate or correct for a maladaptive schema is to strengthen the adaptive schema, but they're all still within the domains, which is why they're color coordinated, all right? So then you get to lay out these.
So there's 2 levels of colour coordination in the way you've sorted this. You've got the outer ring, which is the schemas, and then you've got this little band here, which refers to the the what exactly?
That's the domain.
That's the domain. So this is if it's a maladaptive schema, and then that colour reflects the particular domain.
Yes, and I've given you index cards, and of course they're all colour coordinated as well. So this will give you the schema domains, and it gives you the description of what all the domains are, and then the way that the index works across the rest of them, so that way you can see where it all lines up. So these are just your quick reference cards. All of the cards are also numbered to help those of us with an unrelenting standards maladaptive schema keep them all in the correct order. Okay. Not speaking from personal experience at all.
No, not at all.
But so this really helps people. I use this in training all the time, but I also use this when I'm presenting schema therapy to a patient for the first time ever. Is I'll lay them out and go, right, this is kind of how schema works.
But are you only laying out the cards that's relevant to them, or are you just putting everything down and then?
It depends on the patient. Some patients I don't get it, tell me the whole picture. And some people are kind of really, you start with big picture and then you narrow it down.
Okay, so this
some
is
people,
the universe of maladaptive everything, and then you might focus in on their particular thing.
So then what I do there is, because not all maladaptive schemas relate to every person, is I just pick out the ones that they have. So let's say they had an entitlement schema, okay? Well, we know that they would develop an entitlement schema because their need for realistic limits was unmet.
Okay.
So in order to correct this, we've got to get the need met, which is what the back side of the card is.
Okay.
Which means that in order to kind of adjust or respond in a healthy way to an entitlement schema, then the adaptive schema that we would need to work on is empathic consideration.
Okay. As the antidote to entitlement.
But antidote, yeah. And then on the back of the purple cards, we give you a skill. So not only is there the 14 adaptive schemas, I've also then brought in 14 skills that I think you need to use. So on the back of each of these is a skill of, okay, well, if I need to develop empathic consideration as the antidote to my entitlement, how do I actually do that? One of the core skills for developing empathic consideration is your ability to validate others. So then we've got that Psych Collective acronym of the triple A's for the validation. All right. So some people like the whole layout. For others, I just do this. And we just look at their three. And then we can just focus in on this. And so we might work on this for a little while. And then once this is starting to be we're getting some movement in that, then I might pick up the next three and we work on that. And then the next three we work on that.
Because most people will have more than one maladaptive schema. So would you pick the one that is the most problematic, or
it depends,
or would you get the lowest hanging fruit that you could?
It depends on the patient. My specialty is childhood trauma and borderline personality disorder, right? Almost everyone I work with has a defectiveness schema, but I call this a meta schema. In my opinion, the defectiveness schema actually underlies every other schema that we have. So starting here isn't always necessarily the best way to do it because it's so deep. It's so deep. It's so deeply entrenched. So it might be that we can start to work on the antidote, which is emotional fulfillment. And for this one, we talk about blanket hug. So we start bringing in some self-soothing for the vulnerable child, and I'll do modes later. But in order to get to the defectiveness, maybe what's more workable at the moment is something like the unrelenting standards schema with the adaptive schema of realistic expectation. And can you pass me that one, please?
These two?
Yep. And then so on the back of this is check the facts. So
as
this
the
is
skill.
As a skill. This is a really kind of clear cut, there's clear cognitive restructuring in this. There's some behavioural component to that as well.
Okay, so I need realistic, if I have a unrelenting standard schema, I need to have realistic expectations, and the way I do that is by check the facts.
Yes.
Okay, cool.
So that's the skill to strengthen that, and then that replaces this.
Yep.
Yeah?
Yep.
But this might be way more actionable now because this is quite a structured activity or skill that you would use. And by working on these gets you closer to the point where you then work on something like a defectiveness schema.
Okay, so that might be, that's the overall objective, but we've got some work to do to get there.
Yeah.
Yep.
Yeah.
Okay.
And I mean, not everyone has a defectiveness schema, but it's the most common one that I see in the patient groups that I work with. But it really comes down to, usually when I do the YSQ is I'll look for the top elevations on the graph with the results as they come out. And then I'd be having a conversation with the patient of, okay, what do you want to work on? Where do you want to start? Some things are super actionable straight away. Other things, you've got to do some foundational work to get to a point where they're ready to do that. So you might get the
low-hanging fruit to get a quick win or two and then move into harder stuff, depending on what the patient needs.
Depending on the patient,
Okay.
Yeah. But this helps with that conceptualization of what is the maladaptive schema, why did it develop in terms of the need being unmet, and then what do you do about it, which is you work on getting the need met by strengthening the adaptive schema and using the skill that corresponds with that adaptive schema to then overcome the maladaptive.
Okay, that makes sense. And when you've got that clinician's workbook, does that sort of fit in with that?
Oh, absolutely. It all fits in and it's all color coordinated.
Okay.
All right, and then what I've also put in for this is 3 flashcards as well. So the idea here, it's tiny, but they're designed to be kind of pocket size. There's a full scale version of it in the Schema Therapy Therapist Guide. So what this is basically a summary of the cognitive restructuring that you would use with this. So it's
if I'm let's say this was my thing here, the unrelenting standards was my maladaptive. I need realistic expectations.
My unrelenting standard schema has been activated by making a typo on a PowerPoint presentation, right? Which makes me feel vulnerable, sad, ashamed, whatever. This schema makes me think that I'm not good enough, I haven't performed well, which urges me to desperately overcorrect and overcompensate, okay? Or to cope by, I can't handle this, it's too hard, I'm gonna flick through Pinterest on my phone, yeah? However, I can challenge these thoughts by reminding myself of the evidence that it was one little typo, it's not that big a deal, I don't have to hand back my master's degree because I made a typo on a PowerPoint, which proves that I do actually perform at a reasonably high standard most of the time. A small error does not count for my entire worth. Therefore, I will respond in a healthy way by make a reasonable correction to the PowerPoint presentation and move on.
Get on with the day, yeah. Okay.
So this is when you...
That's the inaction of the... So you've identified the schema, you figured out how it is affecting you in a given situation, and this is how you address sort of the self-judgment or whatever.
Yeah. So this is probably something you would need to work out with your therapist of what the answers are, how to fill it all in. But what we know is the maladaptive schemas, they're so ingrained, they can activate such a habitual reaction that you need that kind of metacognitive awareness and that presence of mind to go, now hang on a minute, I'm not doing that old reaction, I'm planning a healthy adult response. This is your prompt card to say, hey, this is what we're going to be doing differently.
Cool.
Okay, so they're included in here, plus the full page version is in the Schema Therapy Clinician, or Therapist Guide, Clinician Guide. All right, hopefully they're helpful. Look, they're only available in hard copy. We're not doing digital for this one. So you can get them from the resources page from the psychcollective.com. We ship all over the world. If you're using them, if you like them, you think they're helpful, flick us an email and let us know how you're going with that. I'd love to hear from you. All right, thanks everyone. Bye.